I think it goes without saying that the nurses support single payer and are staunch supporters of single payer and have been for many years. And one of the best things that's happened for our union in the past year, as you all know, is the merger that went from having 86,000 members in the California Nurses Association and National Nurses Organizing Committee to now having more than 150,000 members in National Nurses United, which now encompasses the Massachusetts Nurses Association and a number of Minnesota nurses, Michigan nurses, and we're very pleased to have nurses from lots more states than we had before, and the potential of 150,000 single-payer warriors in comparison to 86,000, which was already a formidable force in the single-payer movement. I have been blessed enough to be one of the few non-nurses working for the union who speaks on behalf of the nurses on this issue of single payer. They have sent me now to 43 states in the District of Columbia talking about this issue. So I think I can bring you some glad tidings maybe in the wake of the mess we've seen nationally. And maybe that's the best we can do for one another at this point in our organizing, is say that this is not the 1990s. This is not the aftermath of the collapse of the Clinton plan and health care in terms of the single-payer movement by any means. The movement is much different. The movement is much stronger. The movement is much broader than it was back in those years. The crisis is much deeper in healthcare than it was back at that time. If you think about the current legislation that just passed, it will still leave 22 million Americans without access to any health insurance coverage at all. 22 million. The crisis that drove the Clintons to want to come to some level of resolution of the health reform issue was that there were 22 million uninsured Americans. So that in itself illustrates to us, what do they say, you know, that 40 is the new 60 or 60 is the new 40 or however they do that. I mean, look what we've done with this convolution in our own social justice in this country, to the point that we now all have to listen to this touted as this great success akin to Social Security and Medicare passage, that we're still going to leave 22 million people completely bare for any kind of coverage, and that's a victory. I think those of us who operate in the single-payer world know that's not true. And nobody more so than the nurses know that's not true. On an everyday basis, working with patients and in their own lives, trying to have the kinds of benefits that they need to secure the right kind of health care. If we think about the nurses on strike at Temple right at the moment in Philadelphia, one of the issues, of course, is health care benefits, as it is for so many. It's just intuitively so wrong, isn't it? Mm-hmm. That we can't give our own nurses the kind of access to health care that they provide to others. It's just crazy. So, I come to you from the perspective of a child of the 60s who grew up looking at this poster on my wall next to my bed that said some men see things as they are and ask why, and others dream things that never were and ask why not. That was Bobby Kennedy's words, for those of you who are in my age group. And I know some of you are, I can tell. And I think that as I go across the country and I listen to people after the passage of this legislation, one of the most hopeful things is that we know the scales of justice are very imbalanced. We know that. We know that right at the moment the corporate side of the world is winning the battle on many fronts. So we're tipped way over this side. And those of us in single payer are throwing sand on the other side of the scales. Some of us are throwing a grain or two here or there. Some are putting a spoonful. Some are throwing buckets. And we just don't know, any of us, when that grain is going to hit. It's going to tip it over our way. It's going to hit, but we don't know where we are in that continuum. You know, if somebody had told us a year and a half ago that we would all, in a matter of days, put $750 billion out to Wall Street to bail them out, we would have said, there's no way. There's no way we would do that. If anybody had told Barack Obama 2 years ago that he could be elected president in a race against John McCain, there'd be no way, because polling at that time showed in a race with McCain versus Obama, Obama would win Hawaii and Illinois, and that's it. And he's now the President of the United States. So there's my pump you up message, okay? that we need not feel badly about where single payer is. Quite the contrary. We've grown a lot. Think about what the AFL just did in the passage of Resolution 34. The nurses are so proud to be a part of the labor campaign for single payer, which we'll hear more from tomorrow. If you come to that workshop in the morning at 9, it'd be great. But we're so proud to have been a part of that process and bringing that resolution forward to the AFL, and having that passed unanimously in September at the National Convention was astounding and wonderful. That's a different place we're at right now, a different organizing opportunity for all of us to find out where's the AFL going to take that resolution. How is that going to be put into operation within all of our affiliates to bring that forward? So that's a challenge for all of us to do that. The other thing the nurses have been a part of is it's called the Leadership Conference for Guaranteed Healthcare, which is a coalition of a number of single-payer organizations, all the kind of the major civilian, not nurse organizations, PNHP, the Physicians for a National Health Program, Progressive Democrats of America, the Labor Campaign, CSEA is one of the convening organizations. Healthcare Now is one of the convening organizations. So we're a part of that very strong coalition that's growing and having some growing pains in trying to figure out where to move forward at this point. And I want to let you all in on a meeting that was held on April 10th in Wayne, Pennsylvania. It was held in conjunction with, but not as a part of, a Progressive Democrats of America meeting. In the 2 hours prior to the convening of a regional meeting of Progressive Democrats, we held a meeting of states that are working on state-based single-payer plans to try and form a collaboration of sorts of states to find out where states are. Not that we're giving up the national fight. The nurses are never going to back off from believing that where we have to go is improve Medicare for all in this country. We're never backing off from that. But in the meantime, there are a number of states like California, like Pennsylvania, like Vermont, like 19 states altogether, that have very active in various stages of development state single-payer groups. So we convened in Wayne. There were 10 states represented that day in Wayne. 4 more states submitted reports, and for those of you who are interested, we produced a report from those states of where they're at with their single-payer legislation, how it's going with their single-payer movement in their state. And Ben Day from Massachusetts brought forward one of the best points, that whether you organize your state for state work or you organize it for federal work, it's all to the good. It's all organizing it for single payer. So, sometimes people get a little bit upset because the state folks don't maybe think the federal folks have a lot of reality in play right at the moment that we're going to pass single payer on a national basis. And sometimes the national folks get upset with the state folks because they think it draws energy away from the national fight if you work on the state issue. It's all right. It's all working for single payer. It's all moving it forward. So we also came out with a declaration. We wrote a statement, a declaration of health independence and security. You can go to guaranteedhealthcare.org, which is a California nurse's website, and you can read that declaration that these states came up with, guaranteedhealthcare.org. If you email me a request, I will send you an electronic version of this report. So my email address is Donna S, DONNAS, @calnurses.org, and I'll be happy to send you information. We're also convening 4 working groups coming out of Wayne, Pennsylvania, to work this collaboration, to grow it and help it foster synergy between the states working on single payer, so that we're sharing information on what works, what doesn't work, sister bills maybe, if states have not yet put in their own single payer bills, maybe they can have similar bills that all follow the same principles so that we have things moving forward together. This is a real different spot than we were in post-Clinton health reform, a very different spot. So be very hopeful about that. And put that declaration out to your groups if you can. We're gathering signatures on that declaration, hoping to shoot for a July 4th, 2010 big launch of it. We only released it 2 days ago. We've already got over 1,400 signatures on it. So if you can get groups, individuals to sign up, that's a wonderful thing to do that. So there's a lot of energy. There's a lot to be hopeful about in this movement, but there's a lot of organizing to do. And it's messy and sometimes uncomfortable and sometimes difficult, but we have to do it. It's on the ground. Educating is so important. moving people together. I was so encouraged to see a young face of organizing on the panel. That's such an awesome thing to really broaden the voices that are speaking this country. And to really be what we want to be, the change, you know, that we've heard that before, be the change. Well, we can be in the labor movement. I mean, if in my mind, if organized labor does not protect this issue, does not protect health care issues for its members and for the nation, who's going to? Who is going to it? There's a void right at the moment, and we have to leave that. If there are 16 million union members in this country and we can get even a quarter of them really pulling together on this issue, what a marvelous force that'd be. And the nurses believe we can do it, and we're going to keep pushing forward to do it, and we look forward to helping and having your help in return. Thank you very much.